Hi, it's Karen from one of the midwives from My Expert Midwife again. Today I want to talk about birth plans. Birth plans are really important part of preparation during your pregnancy, and they're great for just getting down your thoughts and feelings of what you would like and what, more importantly, what you wouldn't like in your birth plan. Sometimes I think people feel as though birth plans shouldn't be made because they're too restrictive, and they make people feel disappointed about their birth if they don't go exactly to plan. However, I think they're amazing and they're really needed because it just makes you think that you can have lots of things in there and you don't have to have a specific plan, but all the things that you really want and that are really important to you and that mean something to you can be incorporated in some way at points during your labour and your birth. So definitely make one. Even if you don't hand it out or use it, it will help you to get the ideas that are important to you into your head, and it'll also be really helpful for your birth partner to understand what your wants and needs are, and to also incorporate their wants and needs into the birth plan as well, because they're your significant other and the person that you've chosen to be with you during your birth, and it's important for them to feel really involved in the planning and to be an advocate for you as well during your labour and birth, when maybe you are in a place where you can't express your feelings as much as you might normally do. So I think the first thing in a birth plan would be to consider the environment. The environment is absolutely key to labour and birth, and most women would maybe prefer quite a relaxed and comfortable environment, and one that's similar to maybe at home. So if you're going to have your baby in hospital, trying to recreate the comfort and the relaxation you would have in a home environment in a room in a hospital. So it takes a little bit of preparation to do that, but with a few props you can create something that is really quite pleasing and comfortable in a hospital environment, and that will help you to feel more comfortable and to labour more effectively. So some of the things you can take are like obvious things, like you might have a favourite blanket or a cover, or your favourite pillow, because the hospital pillows are renowned for not being fantastic and maybe being a bit plasticky. So take your favourite pillow in with you and you can snuggle down with that, and it'll also have your favourite smells and things on, and smells that are, sort of, you're used to, rather than strange smells that you might have in a hospital. And also you can take various things, such as you could take birth affirmations, where you can have like little sayings and slogans on, which will keep you positive and encourage you throughout your labour and birth. And you can also take little things like battery powered tea lights and candles in, so you can have the room more dimly lit and more relaxing when you're in there. And also remember that you can move the bed totally out of the way. By moving the bed out of the way in the room, you can create a lot more space, so that will enable you to mobilise and be more active in labour. And also it'll give your partner more space to help you to be more active and to do massage and support you in other ways with a greater amount of space, really. So move the furniture around in your room and get it, design it to how you want it to be. And you can also put things into your birth plan, like you would like to use equipment such as birth balls, maybe a birth stool, and just that you would like the lights maybe dimmer, if at all possible, for the majority of time. You can also stipulate things like you would like to be left alone with your partner for short periods of time during labour, and your midwife can then read that and respect your wishes. So Also, an important part of things is what you would like to do regarding pain management. So management of contractions and pain in labour is something that is on a lot of women's minds. Some women just want to use non-pharmacological pain relief, which are things like a TENS machine, water, aromatherapy and massage techniques, as well as things like acupressure, which you can explore in more depth if you want to. And also there'll be women who want to use everything. So you might decide that you want an epidural as soon as you know that you're in active labour, and that is what your decision is. So you can put that in your birth plan as well. And then you need to think about what you want for during your birth as well. So you may feel as though you don't want to have your midwife instruct you to do active pushing or coached pushing. So if everything's normal in your labour, you may just want to breathe your baby down or listen to your body, so your body tells you when to push. You can put aspects of that in. You may want a warm compress, because there's research now